The recent progress made in improving safety in airline travel is mostly due to better communication and equality between the pilot and the co-pilot. This wasn't always the case. On January 13, 1982, in Washington, D.C., Air Florida Flight 90 was preparing to depart. While the co-pilot repeatedly expressed concerns about icy wings, the pilot ignored 7 different admonitions. The plane went down in the icy Potomac River. The National Transportation Safety Board conducted a post-crash study and found that the airline industry had an exceedingly hierarchical culture, in which many pilots did not value what co-pilots had to say, and thus they ignored them. In medicine, we also have a hierarchical system that needs to change. This module will explore how we can improve and understand the science of safety by understanding how each system is designed to achieve exactly the results that it gets. System-level factors that impact patient safety include characteristics of the patient, of the provider, of the care team, and the work environment, and also institutional and external pressures. As highlighted in the aviation example, team-level characteristics seem to be critically important. In healthcare, the majority of sentinel events, those events that cause significant harm to patients, occur because of communication errors. All of these factors can either defend against or put patients at risk. A careful and honest review of these factors will enhance patient safety. Teams from Michigan hospitals were some of the first to implement CUSP.
We were offered to participate in the CUSP project, and we had done a safety attitude questionnaire, and we had a department, the surgical department, that fell to the bottom of the list of the report as far as their safety culture. And we felt this was the perfect opportunity to start with this particular department. So we talked to our leadership. The budgets weren't that great. They were very reluctant to start a new project. But when we showed them the evidence and the scores, and we were so excited, and we brought them over, and they enabled us to join the project, and we're very glad that we did.
A couple of things that we look at from an administrative standpoint is really cost, access, and quality. And quality is very important to us and the patient's safety, but you have to balance that with how much it costs you as well as an organization. And so some of the things that we were struggling with at the time, like many hospitals, we were in a deficit spending mode. We were losing a little bit of money at the time, so you start looking at staffing and trying to reduce your expenses, which are also very important to us. But then you also have to look at how do you benefit the patient? How do you create a safer environment? And from an administrative standpoint, if we can provide safer care, it's better care, and hopefully in the long run it actually costs organizations and really the federal government less money on health care if we can provide better care.
Some of the environmental issues that we faced were some staffing issues. We had some traffic control issues as far as how people entered and left the departments. One issue was we had an open hallway right off the recovery room where staff just got used to going through there for their breaks, which was an infection control, a privacy issue, a lot of safety issues with that.
As we have heard from my friends in Michigan, examining the characteristics of your system is the first step to understand the factors that put your patients at risk. Just as aviation elevated the co-pilot's role in the cockpit, we need to elevate the concerns of the entire care team and the patients and their families to a higher level. In the next section, we will examine some of the basic principles of safe design.